I'm sorry to cut this program. We have an urgent news for today. The doctor announced that someone was contaminated with Ebola virus from Korea. People and animals are affected with the said virus. Last month, in India there was 13 patients who was transmitted by the Ebola virus. 10 patients died, and 3 patients are still serious condition in the hospital. The symptoms of this virus: you may feel headache with fever in 38 degrees and vomiting. It will be transmitted through nasal secretion, saliva, and urine. At this time, everybody must be careful if you know someone from India or you came from India and you have some symptoms. You must go to the nearest hospital and further check up.
Hello everyone, I have something for you. Are you hungry? Wow, it smells yummy. Yes, I was drinking coffee before coming in the hospital. I heard about Ebola virus. I don't know about the whole story about this. Oh, a cerebral virus. Go around.
Number one, Peachy. I will take care of you today. Come in. Take a seat. What the matter with you?
It's been 1 year ago when I have headache.
Can you tell me how you feel it?
I felt that my head will be broken into pieces. It's so tight, I can't bear the pain. It's terrible.
Oh, I see it in your history that you different hospital, right?
I've been to 8 hospitals already, but my condition still the same. Nothing changed at all.
When did your cough started?
Only few days. Then I have pain my chest when I cough.
Peachy, did you travel out of country?
For past 40 years, I never out of country and never took the plane anymore. But yesterday, we go out with my friend to eat for dinner, and he just arrived from India.
Oh, Doctor, is the person contaminated with the virus that we have seen over the television news?
I think he was not affected with that virus.
How do you feel?
They called the way Harry off and pilot to the policy of the hospital. Okay, let's bring this patient to the isolation room for the further diagnosis, and he is under observation. Let's contact the Ministry of Health for this patient. Okay, quickly do it now. What?
go from the hospital premise. We will transfer the patient to isolate room. We arrange an committee how about method. Okay. Calm down. Calm down, please.
Morning, sir. How do you feel?
Doctor, can I ask you a question? I was contaminated with Ebola virus. Shall I die?
You just have cough and fever. We have to do examination, okay?
Okay.
Excuse me, can I get that from you from laboratory? Are you okay?
Okay.
Sir, are you okay? Doctor, the pulse was very fast, already 200 BPM.
Let's inject him a baby block 10 cc.
Yes.
Hurry up, hurry up.
Yes, doctor. Sir, how are you feeling now? What happened? Doctor! Doctor! He is unconscious.
Let's inject him adrenaline 10 cc.
Okay.
Hurry up.
Yes, doctor.
Sir, are you alright? Sir,
Sir,
he is arrested. CPR.
not Abu! Not!
1 and 2.
I think our patient don't have chance to recover again.
Our patient have a complicated disease. The nerve in his intestines are not functioning and he had difficulty in breathing. But we have to do our best to diagnose for the cause of his illness before he become weak.
I think he have a chronic lung disease since his chest is painful and he had difficulty in breathing and his heart is shaking.
Does the patient have heart disease?
But the patient doesn't smoke. He is not diabetic and in heart disease.
The lymph nodes swollen and his sense organs are more floating.
Doctor, what is the disease of our patient? I never in his history that he was cured his illness.
I think the disease is starting to go, but the symptom is already there.
I think it is Ebola virus.
Oh no! Sir! Are you okay? Oh my gosh! What happened? Oh no!